Hello everyone, this is Dr. Gaines with the Melville School District, wanting to provide you with a little bit of an update on some COVID data and some planning that we've been doing. So let's start with the data. We've been tracking for several weeks, really 4 measures that we've kind of been in conversation with area districts and Education Plus and some health officials about. The first of those is transmission rate. Transmission rate comes from the state and it gets published every Wednesday typically. The August 19 data came a few days late. The September 2nd data hasn't come yet, or as we record this, it hasn't come yet. But what we're looking for is a transmission rate below 1 because that indicates a reduced spread in the virus. And for the past 2 weeks, the past 2 Wednesdays, August 19th and 26th, we've been below 1, so that's been a positive after several weeks well above 1. The second piece is the positivity rate, which is at the county level. And on the positivity rate throughout the month of August, we've seen it kind of hover back and forth between the mid 7s and getting up around 9. Really, we want to be below 10 for sure, but ideally we want to be below 5 in terms of positivity rate. The next piece we look at is the percent change in daily new cases, and we're looking at this in just the primary zip codes that we serve, 63125, 28, and 29. And really we're looking at a 14-day period, and we're comparing the first 7 days to the second 7 days and what that percent change is in new cases. And really what we want to see is a percent change of a -10 or less or greater, depending on how you want to talk about that. But you can see from the line graph here, it's been very erratic, so this hasn't been a very reliable measure for us. But the overall trend during the month of August has been relatively downward. The last piece is the one that folks are really starting to hone in on, as it seems to be a key measure, and it's something that comes out of Harvard's Global Health Institute, and that's the 7-day average of new cases per 100,000, with 25 being the high threshold, and we don't want to be above 25, and we've spent a lot of time in the month of August above 25, but the last week, the last part of August, we've done a little bit better in our zip codes. Ideally, we would want to be down below 10, but there looks like some things that we may be able to consider as we get in that 10 to 24 range. And that is really driving our conversation around what can a return to school look like. So we're in our connected model currently, but how do we move to a blended or an at-school model? And the conversation of late has been, it doesn't have to be this linear movement of K-12 making a move all at the same time. So what is likely going to happen is that we're going to start by bringing our early grades first and then begin to phase that up. So that means that we could have elementary or early elementary in our blended model while others are in our connected, or we could even be in a place of some kids are at school 5 days a week, some are in our blended model of 2 days a week, and others may still be in our remote connected learning model. So we could have different grades in different models, and we could have different schools in different models if once we come back, we begin to have an outbreak in a particular location in which we would close a classroom before we would close a school, and we would close a school before we would try to close the entire district. So we could be kind of all over the place there in that regard. So what's going to happen then is we're looking at data every single day. We look at our zip code level data every day. The positivity rate, we look at that about twice a week, and then that transmission rate, that gets reported once a week. And what we see is that data changes. So sometimes that positivity rate gets updated from prior days, so we have to play with that and make sure that what we have is the most up-to-date, publicly available data. We also know that data from the county is going to change in terms of what they're going to report. And we've not seen that yet, so we don't know how that could influence our decision making. But we know it's going to come at age. We think it's going to come at zip code as well. So that will have an impact as we think about how we move forward. What we're moving to, or what we've been talking about, and what we've been working on, is that each and every week we're making a decision around what model we need to be in over the coming weeks and what that could look like. So can we make a change? Can we get to a level of in-person schooling based on the conditions, based on recommendations from the county? So we're constantly watching that, we're constantly monitoring, and we're going to try to give you notice when it looks like we can make those changes. It's going to be at least 5 days of notice, 5 calendar days of notice before we make a change. Maybe we'll be able to do a little bit more, but we want to be able to get kids back in school as soon as possible. One of the things, though, that we're really, really worried about is this weekend. It's Labor Day, and we've seen an increase in cases across the region over the last holiday, 4th of July. And we saw that about a week after the holiday. So while we want everybody to have a great Labor Day weekend, I hope you'll wear a mask if you're around others. I hope you maintain social distancing. I hope you try to avoid large gatherings, and please limit your physical contact with others. We need everybody to do these things so we can get back to school at an in-person level as soon as we can. So thank you all for taking the time to watch. I hope you all do have a great weekend, and hopefully through the efforts of everyone, we can be back at an in-person level of school as soon as possible. Thank you.